want to remind everybody that medical science progresses one funeral at a time because the protectors of the old theory, the failed theory, hold on to it because of their egos, and they've invested their entire lives in the old theory, and once it's proven wrong, they don't want to let go. They don't want to admit, gosh, I've been going down the wrong trail for 60 years, and so it waits until they dies before it moves up a notch to the next theory. Okay? Well, I want you to think about it. We can cure night blindness with vitamin A. We can cure pellagra with vitamin B3 or niacin. We can cure beriberi with vitamin B1, thiamine. We can cure scurvy with vitamin C. We can cure things like rickets with vitamin D. And, you know, it's just amazing how many things. Oh, we can prevent, and of course, this is one of my lawsuits against the FDA. I can reduce your risk of certain cancers by supplementing with selenium, the mineral. We can prevent spina bifida by supplementing women before they get pregnant with folic acid. We can prevent club feet by supplementing with zinc, okay? And we can prevent certain heart defects by supplementing with zinc and so on. And we can prevent vascular breakdown by supplementing with copper. For instance, things like aneurysms and spider veins and varicose veins and hemorrhoids, a copper deficiency, okay? And so there's many, many others, but those are the ones that come to my mind very easily. And so why not others? Well, it's simply because doctors don't want to let go, because they've invested their whole lives, their egos, their personal reputations, and so forth, and they don't want to, they just can't get their arms around the idea that, gosh, I've been selling the wrong theory here for 60 years, and it'll just have to wait till I die before the next one comes along. Well, I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. I'm here to tell you, you're going to love this book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, because, of course, that's one of the biggest theories, but it only lasted less than 100 years. The genetic theory, think about it, it's only lasted less than 100 years. The theory that diseases are caused by evil spirits lasted for thousands of years. And, of course, the reason why the theory that genetics went away so quickly was because we have all this equipment and electronic stuff and microscopes, and we have the ability to track things and computers and so forth. So it's very easy to disprove the theory of genetics. Now, there's not a single disease that's transmitted by genetics, although there'll be many, many people, heads of departments and so forth, that will hold that theory until they die, and then it'll ratchet up a notch. And so one of which, of course, my theory is, and of course I believe I have enough proof that cystic fibrosis is caused by nutritional deficiencies and not certainly genetics. It's kind of an interesting disease, cystic fibrosis. It has several pieces. It's got a lung piece, lung disease. It's got pancreatic disease. It's got liver disease. Halfway through the life of the people with cystic fibrosis, they have a very, very high risk of getting type 2 diabetes. And the medical doctors hold on to the theory that it's a genetic disease. Remember, Emory University and the Yerkes Primate Center fired me in 1978 because I proposed that cystic fibrosis was not a genetically transmitted disease as they believed, but a simple nutritional deficiency during pregnancy and could actually be reversed after the kid was born with supplementation. And they fired me for that thinking. And then here comes Jerry Lewis. So we gave Jerry Lewis what we believe was the pathogenesis that caused prevention and cure of muscular dystrophy, and he got excited, and these are Jerry's kids, and he wanted to be the one to make the announcement that the cure had been found. So he went to the Muscular Dystrophy Foundation. They fired him. That's why he hasn't done the telethon over the last 3 or 4 years. So I urge you to get hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and you're going to realize that, gosh, there's so many things went wrong here with these theories. What about the genetic theory? Well, the genetic theory itself, James Watson, the guy in 1962, he and Francis Crick, Watson and Crick, got the Nobel Prize for the proposal in 1953, that the structure of DNA was a double helix. And they needed that structure, kind of like a blueprint, to be able to manufacture a good gene to replace bad genes. That was the theory. Well, March 22nd, 2013, Watson gets up in front of an illustrious crowd and says you can sequence 150,000 people a day, sequence the genes of 150,000 people a day who have cancer, diabetes, and other diseases thought to be genetically transmitted. You're not going to cure a single person because all the experiments we've done, I'm quoting him now, all the experiments we've done over the last 60 years have been irrelevant. None of it's genetic, he said. It's all chemistry, biochemistry, a.k.a. nutrition. I guarantee you nobody in that room took a breath after that. Because here's a guy they respected who said they've been going down the wrong rat hole for 60 years. And when you read this book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, it will take your breath away. I want you to think we're doing in our final edits of a CD that covers this whole thing. One of my more recent lectures, we're just still picking out the title for it, but it's going to be earth-shaking. If you think Dead Doctors Don't Lie was earth-shaking, wait till you hear this new CD coming out. Ask your young deputy associate for the newest CD. Get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, and see where the medical system has failed you. They want you to believe that Alzheimer's disease is genetically transmitted. But then they say if you read a book every month, you can reduce your risk of Alzheimer's disease. Well, it's fourth grade biology. It ain't genetic, because you can't affect a genetic disease by reading a book. Wow. Okay, well, stick with us. We're going back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for These Nuts. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought I'd talk a bit about cancer, as I've got an ABC News story here headlined, Cancer Tops List of Surprising Health Problems Tied to Obesity. And they say that there's actually 8 different disorders or problems that people that are overweight and obese have. And they say that one of those is cancer, the other is migraines, infertility, premature birth, sleep disorders, and people that are obese don't make as much money, and they also have a difficulty time finding a doctor. As far as the cancer goes, a new study found that 10% of all gallbladder, kidney, liver, and colon cancers are tied to excess weight. 41% of uterine cancers are tied to obesity. This was all published in the journal Lancet. And I say more than 36% of Americans are now considered to be obese, according to the CDC, and an additional 34% are considered overweight. And in the Lancet study, they looked at 5.4 million people, and for every 1-point population-wide increase in body mass index, it resulted in 3,790 additional cancers each year. They say the BMI in the U.S. has risen 2.5% in men and nearly 4 points in women since 1971. According to the National Cancer Institute, obesity contributes to about 34,000 new cases of cancer in men every year and 50,000 in women. And a study published in the journal Neurology surveyed nearly 4,000 people, found that those that have excess weight were in obesity were 81% more likely to experience at least 14 migraine episodes each month. And they also found that women that are obese, 90% of those had developed polycystic ovarian disease. They also have a harder time getting pregnant. Those obese women that do get pregnant often have preterm babies, especially when their BMI is above 35. They said, according to the American Sleep Foundation, nearly 80% of older obese Americans have trouble sleeping, which has been linked to diseases like diabetes, heart disease, and ironically, obesity itself. Harvard Nurses study found that those who slumbered less than 5 hours a night were 15% more likely to gain weight. And those that are overweight and obese, Yale study found that they were more likely to be bullied at any age, and most 40% of those being bullied were actually being bullied by family members. And the doctors, 67% of doctors that were surveyed said that overweight men and women were being shamed in the doctor's office. 50% of doctors found that fat patients were awkward and ugly, weak-willed, and unlikely to comply with treatment. And 24% of nurses said they were repulsed by obese patients. And then finally, George Washington University School of Public Health study found that obese people make a lot less money than regular people or those that are thinner. So there you go, yet another reason to get on the ASAP.
ASAP, right. Well, it's kind of interesting because all the diseases you're naming have something to do with mineral deficiencies, and mineral deficiencies are the cause of obesity. Obesity is not caused by overeating and lack of exercise. There's a wonderful research project by Loyola University School of Medicine in Chicago, came out in January of 2009. Exercise does not help you lose weight, and it was a cover story in Time magazine, August of 2009. Exercise does not help you lose weight. And so these mineral deficiencies for diabetes, high blood pressure, insomnia, high blood pressure, heart disease, all this stuff, cancer, all these things are actually caused by mineral deficiencies. So mineral deficiencies cause obesity, and so it makes sense that they would all run together. Obesity doesn't cause these diseases, but they're risky because when you're minerally deficient, you can get multiples of diseases, including obesity and the others. Very good. Thank you so much, Doug, and we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Well, let's head to California, and Madru, you're on with Dr. Wallach.
Hello, Madru, you're on the air.
Hi, Dr. Wallach.
Hi.
I have a gentleman. He has glaucoma, cataracts.
Wait a minute. You got both glaucoma and cataracts?
I got more.
Okay.
Diabetes, prostate problems. He's got hip problems, knee problems, and his feet now are very dry and top to bottom. And he's got neck problems.
Okay, so he's got hip and back and neck problems.
And blood pressure in the eyes, glaucoma, and diabetes.
Okay, now, let's see here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. He's got 10, 12 diseases here. How much does this guy weigh, and how old is he?
He's about 5'10". He weighs about 220.
And how old is he?
Probably about 52.
Okay. Now, what do you think the underlying problem is here?
Well, it's the blood pressure, and it's also, well, it's actually his bones are...
Okay, no, that's not exactly what I'm asking. Okay, does he have any skin problems other than dry feet? Does he have any other skin problems anywhere, like eczema, dermatitis? Did he ever have any asthma as a kid, you know?
No, but he is starting...
Taken out?
Yeah, gluten-free.
Huh? He had his appendix taken out, right?
I don't know that.
Oh, I thought you said yes.
Yes.
Okay. Well, I believe that he's got a gluten intolerance. That would be my belief. Because when you have 8, 10, 12 diseases, all of which are nutritional deficiency diseases, the odds are you have a malabsorption problem. The most common malabsorption problem would be a gluten intolerance. So I'd have him listen to that CD, Serial Killers. I want him to get off all the bad stuff. No fried foods, no processed meats with nitrates, nitrites, no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami. I also want him to, let's see here, get off of all oils. That would be olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oil, and no gluten, no wheat, barley, rye, and oats. Now, Shar?
Yes.
Yeah, this is a Shar thing. What would you do for this guy? He weighs 220 pounds. He's got diabetes. He's got prostate cancer. He's got high blood pressure, glaucoma. He's got problems in his hip and his back and his neck. High blood pressure. What would you do for this guy?
Well, I would get him on 2 blood sugar packs, and then I would add a lot of stuff to it. I would add...
Exactly. And so we're going to get him on a gluten-free diet, no fried foods, no processed meats, no oils. And then, as Shar said, you want to go for the immediate life-threatening thing first. Certainly, prostate cancer can be life-threatening, but the type 2 diabetes has lots of complications, heart disease, stroke, and that kind of stuff, amputations. So let's deal with that, and we're going to run to one of these message moments, and we'll be right back after these messages. Okay, Doug, let's go right back to California and Madru. Okay, so again, as Shar said, Madru, absolutely no bad stuff, no fried foods, no processed meats, no oils. We want this guy, 220 pounds, to have 2 of the healthy blood sugar packs per month, a full dose of everything twice a day. Make sure he's testing his fasting blood sugar before he medicates himself every morning, and then as his blood sugar drops, he takes less medications he's been taught. If his blood sugar goes up, he's got to take more medication as he's been taught. And then, because he has neck and back and hip problems, I would also throw in the glucogel, which is a mix of things that actually support and promote healthy maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And that would be 15 of those a day for a big guy like this, 220 pounds. It would be 5 at breakfast, 5 at lunch, 5 at dinner. So it would be 2 large bottles a month of the glucogel. And then I'd also, for the prostate cancer, according to the University of Arizona, big study, selenium supplementation is a great way to reduce the risk of prostate cancer, okay, by as much as 69%. But once you have prostate cancer, certainly selenium is a great way to support your immune system, and I would have them take 3 of those, 3 of our bottles of selenium a month. That'll be 3 at breakfast, 3 at lunch, 3 at dinner. Again, that's to support the immune system, which is your best friend when you have any type of cancer. For the high blood pressure and the glaucoma, I would also have him take 3 of the Ultimate Daily tablets 3 times a day, because he's a big guy. That's 2 bottles a month. Again, 3 of the Ultimate Dailies 3 times a day, 3 at breakfast, lunch, and dinner. And they're designed to support and promote healthy blood pressure. They're designed to support and promote healthy blood flow through obstructed arteries. And this also would actually support healthy ocular pressure. Certainly he does not want to just cold turkey off his drops if he has glaucoma, but go in on a regular basis, let his doctor test his pressure, and as his pressure goes down, the doctor will reduce his drops. The dry skin thing, obviously we have all kinds of skin moisturizers from our Soul Purpose and other things, but if our assumptions are correct here that he does have a gluten intolerance, by getting on the gluten-free diet is going to increase his efficiency of absorption and support healthy, more efficient absorption, and this will allow more healthy fats, including omega-3s, to be absorbed, and this can actually contribute to healthier skin. So give us a call every once in a while. Let us know how this guy's doing. And we want to know his weight. We want to know his blood pressure, his blood sugar values, what his doctor says about his glaucoma and prostate cancer, and so on. Okay, Doug, let's go to callers.
All right, let's head to Detroit, Michigan. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Dr. Wallach, how you doing, sir?
Okay, sir. How can we help you?
Good. I've got a young lady on the line, Miss Felicia. She's 35, 5'4", 246 pounds. Got a growth. She's got diverticulitis.
Wait a minute. 246 pounds?
No, 246.
Yeah. Okay. Well, we'll be back with you guys. Hang on. We'll be back after these messages. Okay, Doug, let's go right back to Michigan. Anthony, okay, this lady, 246 pounds. She has diverticulitis. What else she got?
Acid reflux. She's had surgery last year on her spine for a growth. I believe she said CAT scan on Monday and a colonoscopy, and she had an epidural in 2007.
What was the epidural for?
I was having a baby. I had a baby.
Oh, you had a baby. Okay. All right. And what's the colonoscopic exam scheduled for? I know it's going to be an examination, but you already know you have diverticulitis, so what else you got?
Yes, but I have high blood pressure, and I have diabetes type 2.
Okay. All right. Okay, Shar, what's her basic underlying problem?
She's got a gluten intolerance for sure.
What gave you that clue?
So many different things wrong with her, and she's overweight, which she's not able to absorb the nutrients, which her body's starving for.
Okay, if she can't absorb stuff, how come she's overweight?
Because she can absorb sugar, and that's it.
Ah, okay. How tall are you?
5'4".
5'4". Okay. All right. So where would you start, Shar? What would you give her?
She needs at least 2 healthy blood sugar packs to start with, and then she needs a lot more stuff to add to it.
Okay, what would you do for her high blood pressure?
I give her Ultimate Daily.
Okay. Yeah, so Shar's exactly right. I'm sorry, ma'am. What is your first name?
Felicia.
Alicia, okay. Okay, Alicia. Yeah, Shar's exactly right. You need to get on a gluten-free diet. That's your basic underlying problem here. You need to get absolutely drop-dead gluten-free. No wheat, barley, rye, or oats. That absolutely means no wheat, barley, rye, and oats. There's no gluten-free any of those things. I mean, you find it like, in a malted milk. Well, what is malted milk made out of? It's barley malt. And so you got to really watch what you're eating. Scrambled eggs. We talked to a guy this morning. He's eating scrambled eggs in restaurants, and he says he's not getting any inflammatory foods. I said, no, you're getting inflammation from somewhere. And so he calls the restaurant, and the scrambled eggs are in a carton. They're not real cracked eggs. They're 60% oil, 20% egg powder, and 20% wheat flour. And so you got to find out where you're getting all of your wheat, barley, rye, and oats. It's going to be in hidden places. So once you get a hold of that CD called Serial Killers, so you can find all the places you're going to find gluten, wheat, barley, rye, and oats, And then you got to be drop-dead gluten-free. Everybody in your household, the dog, the cat, the bird, the fish, man, mother-in-law, kids, everybody's got to be gluten-free because of cross-contamination on the food preparation surfaces, the laundry, the couch where everybody watches TV, the bed, and every place, okay? But Char's exactly right. I'd start out on a minimum, and you're right at that cusp. You could actually go faster if you want to. Char suggested a minimum of 2 healthy blood sugar packs. You might even go to 2 healthy blood sugar packs and an extra bottle of sweeties. So you could take 9 sweeties a day, 3 at breakfast, 3 at lunch, 3 at dinner, and then 2 full doses of everything else twice a day. Because you have high blood pressure, as Char said, I'd have you take in the Ultimate Daily Tablets. And again, they're designed to support and promote healthy blood pressure levels. They're designed to support and promote healthy blood flow through obstructed arteries. Reflux, what would you do for the reflux, Char?
Reflux, if she can take the enzymes, the ultimate enzymes.
Yeah, the ultimate enzymes. Exactly right, girl. I'd have her take, say, 2 of those ultimate enzyme capsules 2 to 5 minutes before each meal. And they actually have stomach acid. You don't have acid reflux, dear. There is no such thing as acid reflux. That's one of those failed medical theories. You don't have acid reflux when you have reflux. What you have is a lack of acid reflux. As your pH rises, okay, what happens is you get your pH, your blood, or your stomach environment pH above 2. You start getting up into 3 and 4 and 5, approaching neutral, which is 7. This encourages the growth of yeast and bacteria, and then you eat, and they begin to ferment stuff and create gas, and you belch and burp and reflux and so forth. But you get your stomach acid down to below 2, say 1.2, 1.5, I mean very acid like battery acid. It sterilizes your stomach, and yeast and bacteria won't grow. So you need those enzymes, ultimate enzymes. I'd go ahead, a big girl like you, I'd go ahead and take 2 to 5 minutes before each meal, a couple ounces of water. I'd also get our... Char, what would you do for immediate relief?
What do you mean immediate relief from?
From belching, burping, bloating.
From immediate relief?
Yeah. 10-second relief.
Peppermint oil.
Okay, well, you got it. Peppermint oil. Yeah, we have our Ancient Legacy peppermint oil. I'd go ahead and put 4 drops in 8 ounces of warm water and sip on that through your meals. Whatever you have left at the end of the meal, just chug it down. And then, let's see here, the high blood pressure, I talked about the Ultimate Daily Tablets. And then for the weight loss, I'd go ahead at 5'4". I'd like to see you weigh 135 to 140. And so you need to lose 110 pounds, maybe 120 pounds. And so I'd have you take 2 bottles a month of the ASAP. ASAP, take a full dropper full under your tongue 30 minutes before each meal and a full dropper full under your tongue 15 minutes before each meal, and after a couple of days, you'll begin to lose a half a pound to 2 pounds a day. Then call us every 2 weeks, you guys, and let us know your weight, your blood pressure, your blood sugar numbers, and so forth. Okay, Doug, let's go to callers.
Oh, let's head to Louisiana, and Lisa, you're on with Dr. Wallach.
Lisa, you're on the air.
Hi, Dr. Wallach. Thanks for your time.
You bet. How can we help you?
Okay, my husband has esophageal cancer. 7 weeks ago, it was localized, stage 2. For the past 10 weeks, he's done the no oils, no fried foods, no gluten, no wheat, rye, barley, or oats, no sugar. He's been eating 90% raw. He does take selenium. Okay. So we were wondering what longevity offers to maybe help. He's having some...
How much does he weigh?
He weighs 198 pounds.
Okay, so does he have any other issues other than the esophageal cancer?
No, he's 6'3". He's starting to have swallowing issues, and he has great blood pressure. Like I said, he eats great.
Okay, yeah, it sounds like you're on the right track. Okay, now, Char, what would you do to enhance Lisa's husband's immune system, which is your best friend when you have any kind of cancer? What would you do to supplement him to enhance his immune status?
I would get him on 100,000 auric points a day, and that would be the triple treat chocolate and the Cell Shield RTQ. He needs to take selenium, the Ocean's Gold because of the sea cucumber, and Fucoid Z.
Okay, exactly right. So, okay, Lisa, a big guy like your husband, 198 pounds, we'd like him to go ahead and I'd go ahead and take 2 healthy brain and heart packs per month. That's going to allow him to have 3 of our selenium twice a day. I go ahead and get another bottle of selenium so he could take 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. A full dose twice a day of each of the other things in the Healthy Brain and Heart Pack. That's going to give him the basic stuff that we all need just for normal functioning. But then, as Shar said, he needs to get his ORIC points above 100,000 to support his immune system, support his ability to deal with free radical damage, which drives cancer. So we want him, as Shar said, he has choices, or he can mix and match. He could take in 6 of our triple treat chocolate and get it in boxes of 100 is the cheapest way to do it. Each piece the size of a pat of butter. 2 for breakfast, 2 for lunch, for dinner, or 3 twice a day. And then the Cell Shield RTQ is another option. It's resveratrol, turmeric, and quercetin, 5 of those twice a day. And again, they're all going to support his immune system, give him 100,000 ORIC points. Call us every couple of weeks. Let us know how he's doing. Lisa will be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to North Carolina. And Calvin, you're on with Dr. Wallach.
Calvin, you're on the air. How can we help you?
Hello, Dr. Wallach.
Yes, sir. What's up?
Well, I'm having problems with mucus buildup, hacking, and congestion. And I also have problems with the cataracts, the bleeding in the back of the eyes, and neuropathy.
Okay. Neuropathy, did you say?
Yes, sir.
Now, is this in your feet or hands or where?
Both.
Okay. All right. Neuropathy, feet and hands. Okay. Okay. Now, this mucus and congestion, is this in the lungs?
Well, I think it is. It's just I'm hacking and I can't get the mucus to come up.
Okay. Now, how has this been going on? All your life or just the last week?
Well, it's been going on for quite some time.
Okay.
Probably.
Yeah, wait a minute. Do you have any history of any skin problems, any eczema, dermatitis, or psoriasis?
No.
Do you have any history of asthma as a kid?
I think so. I think we were having problems with that.
Okay, you did have asthma problems as a kid, like wheezing and coughing after exercise, or allergy season, anything like that?
Yeah.
Mm-hmm. Okay. Did you have any constipation or diarrhea problems as a kid or a young adult?
A little constipation, I think.
Okay. Do you have any brothers and sisters?
Yes.
Okay. Do they have any of those problems?
My sisters do. Some of my sisters do.
Okay. Now, do they have skin problems, asthma, appendix out, anything like that?
Yeah.
Okay. Okay, Shar. Okay, well, first of all, Calvin, how much do you weigh?
About 150.
Okay, and how tall are you, sir?
About 5'3", 5'4".
Okay. Okay, Shar, what's his basic underlying problem?
He's got a gluten intolerance.
Yep. Yeah, and you need to warn your sisters and brothers because they have it too. Your mama passed it on to all of you. Okay? And so what would you do for a basic starting program? He's got lots of things going on here. What would you give Calvin for a basic starting program, Shar?
I think I'd just give him the Healthy Start Pack 2.0.
Very good. Healthy Start Pack 2.0. 150 pounds, I go ahead with 2 of them. That would be a full ounce of the OsteoFX Plus at breakfast and dinner. 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner. 3 of the EFA Plus as a breakfast and dinner. And then, because you have neuropathy in the hands and feet, what would you do for his neuropathy in hands and feet, Shar?
Daily. Ultimate Daily.
How about
Glucogel, too?
Yeah, glucogel, yep. Neuropathy, he's got a disc problem usually. Degenerative disc disease, squeezing the nerves, causing sciatica down the legs. Okay, that's what I would go with. I'd sort of go a different direction there. I'd go with the glucogel. I'd go ahead and give him 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. And that's designed to support and promote healthy maintenance repair of the disc in between the vertebrae, support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue. And the goal here is to thicken those discs, push the vertebrae apart, take the pressure off the roots of those nerves, and relieve that neuropathy. Also comes, you can actually get a couple of bottles of our wide mouth bottles of our CM cream, apply that to your back, and that'll give you some temporary relief. Now, what would you do for lung stuff, Shar? You had a history of maybe asthma as a kid. He's got some congestion and mucus and coughing, hacking and coughing over the last couple of months or something here, and he's not getting any resolution. What would you do to help that?
Personally, what I would do is I would take Killer Biotic, and I would also take some maybe Oxybody or...
Okay. Yeah, you can take, in case there is an infection there, Oxybody, it'll support respiratory health by giving more oxygen. It's an oxygen supplement. And then Killer Biotic is designed to support your immune system and kill a few bugs. And so give us a call, Calvin, every couple of weeks. Thank you, Shar. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.